Australia. Prime Minister Kamla Persad Bissessar commissioned the start of services at the Scarborough General Hospital on Wednesday. In her address, she commended the people of Tobago for their fortitude despite the long wait for the facility. Here's more.
Even speakers who addressed the audience at the commissioning of the Scarborough General Hospital described the event as joyous and historical. The event was overshadowed by an undertone of finger-pointing and blame-laying. This was in respect to the length of time it has taken for this hospital to be completed. Featured speaker at the event, Prime Minister Kamla Persad Bissessar stated that she was delighted after many delays, doubts and misgivings. The people of Tobago will finally see the delivery of the Scarborough General Hospital.
And indeed, it's about time. We were talking about this hospital like a baby and over the years, but when I'm counting the years, it's no longer a baby. It's a teenager at 14 years old. If you count backwards, it's no longer a baby, 14-year-old. So you're inheriting and commissioning today something that is already mature, and therefore the nurturing thenceforth for the other phases should be much easier.
She went on to charge the members of the Executive Council to ensure that the rest of the hospital is delivered to the people of Tobago soon.
Today, I charge you, sir, and the THA to get the rest of it done.
The Prime Minister further commended the people of Tobago for the fortitude, patience and dignity with which they held out, given the history of the hospital since construction began.
This was not a disaster of your making or our making, but it was an issue I mandated must be resolved. And here we are today, making you the promise that for as long as my government continues, we must never allow history to repeat itself in the way it did for the past 14 years.
Sections of the hospital are now available for the delivery of services to the public. Some of the services are outpatient clinic services, including general practice medicine, pediatrics, obstetrics and gynecology, general surgery, urology, internal medicine and dermatology. There will also be point-of-care testing, which will provide blood results in less than 30 minutes. Also being provided is radiology, ultrasound, mammography, bone density scan, pharmacy and mortuary services. Gail Ashley for Channel 5 News.
Member of Parliament for Tobago West, Dr. Delmon Baker, described the commissioning of services at the Scarborough General Hospital as pivotal in the history of Tobago, while Chief Secretary Orville London said that the event was symbolic since it spoke to a number of mistakes made but corrected.
Member of Parliament for Tobago West, Dr. Delmon Baker, was very emotional as he addressed the audience at the commissioning of the Scarborough General Hospital. Dr. Baker pointed out that he was indeed happy to see the delivery of services to the people of Tobago begin at the hospital. He revealed that he practiced at the old hospital and stated how difficult it was because of the lack of basic equipment. Dr. Baker said he expects the caregivers at the hospital to give better service to the people of Tobago.
$700 million ain't cheap. The new CT scan, MRI, Dr. Fuad can, which I'm expecting. Echo machines will not come cheaply. The new HCU and ICU to come is not a cheap unit. We have spent collectively so much in this facility to give all of our caregivers capacity. And with that new capacity, we expect you to give to the population a greater degree of service.
Meanwhile, Minister of Tobago Development, Vanilla Allen Toppin, pointed out that early in 2010, she acted as Minister of Health. She said from that time she started to work to get the funds necessary so that work would continue at the hospital.
Today we sit in a place that we are proud to call the new Scarborough General Hospital. It is for us a triumph because we are into office 2 years, 24 months. And where it took Dr. Baker a whole lot of men perhaps to try to bring this to birth, it is the woman who has brought it to birth. We today celebrate our Prime Minister for being the driving force behind this facility.
Chief Secretary Orville London in his address said the watchword going forward should be meaningful collaboration for optimum delivery.
As we sit here together on the threshold of success, and I see the threshold of success, how those stories over the past 8 years unfold, and how the climax will depend on our mindset going forward. It will depend on whether we allow pettiness, grandstanding, and blame-laying to be the focus, or whether our focus is going to be on what I call meaningful collaboration for optimum delivery.
Mr. London further pointed out that this hospital is very important to the people of Tobago. He said the Tobago House of Assembly and the Tobago Regional Health Authority must continue to focus on intensive training and fostering increased sensitivity on the part of their employees. Gail Ashley for Channel 5 News.